So, hi, Dr. Davis. We're really happy to have you join us today and to work on your personal learning plan. We're just going to go through some questions to help you identify your learning needs. Is that okay with you?
Sure, Bruce.
Okay. So, from working with other PRA candidates, we know that this process is really going to be helpful to your ability to get all your credentials and to help you study and pass your licensing exams. Do you have any questions before we start?
Oh, well, I'm glad you mentioned the exam because that's really one of the things that's on my mind because, of course, I haven't had to do anything like that in so many years. And, my basic preparation was so long ago that, that's definitely on my mind.
Yeah, well, that's great. And you mentioned your basic preparation. It would really help for us to develop a working plan if we can learn a little bit more about your background and your work. So I'd appreciate it if you could tell us something about your practice.
Well, I've been working in Northwestern Washington with a family practice group. Yeah, seeing your usual run of patients. Mine tended towards the elderly. I inherited a practice with older patients.
Okay. And where are you working now?
Well, now, I'm working out of Quesnel and so getting to know the community there.
Okay. And how many doctors are in your clinic that you're working in?
Well, there's four. There's four other docs and me.
Okay. And are you going to be working anywhere else besides the clinic?
Well, the plan is to rotate into the into emergency, but
Right.
We haven't started that yet.
Okay. And how about obstetrics? Are you going to be doing any deliveries?
No, I haven't done that.
Okay.
Not planning on that.
Operating room assists?
That's something we have been talking about. There's a real need for that in the community now. I have to say I haven't done that in a very long time since residency. So yeah.
Okay. And is there anything else that you'll be doing in the clinic itself besides just regular seeing patients? Are you going to be doing anything like lumps and bumps or any working with oncology or any perinatal care, anything like that?
We had, those are some discussions we're having. I'm very, comfortable with the lumps and the bumps and that sort of stuff. I have not really done much around oncology. The practice I was in, we had access to specialists. It was a larger community than I'm in now.
Okay.
There is a doc here that is doing something special with some chronic conditions patients. I'm really not quite clear on that yet, but
okay.
Yeah.
And can you tell me what EMR you're on?
Oh, we're on Oscar.
Oh, yeah. I've heard that a lot of people don't like that EMR, so don't be surprised if you're having some troubles for it. And you could, even advocate for some change because many people are shifting EMRs if you find that it doesn't work very well for you. And we can help link you up with a better EMR vendor or someone to help you with your EMR if you want to.
Yeah, well, the EMR I was using down in the States isn't available here, so no matter what, I'm going to be learning something new. So
okay, yeah. Well, we're here to sort of be able to help support you with anything that you might need with that in there.
All right.
And are there any other problems that you're identifying working at your clinic?
Well, I'm having a little bit of trouble, getting used to the rhythm of the clinic and the timing and the paperwork. And I'm finding, I'm staying much longer than I need to, not getting home on time, that kind of stuff. So, that's been on my mind. I'm also, frankly, really surprised about opioid prescribing in the community.
Yeah, we'll get to that maybe a little bit later if it's okay. And I'm curious, though, what's working well for you at your clinic?
I'm getting along, I think, with the patients and the other staff really well. I mean, the clinical stuff is, it's pretty familiar to me. The kind of things I had been seeing. I am seeing a few more younger people than I had, which is kind of enjoyable. So the clinical part's great, and the team's great at the clinic. I like the folks I work with.
I'm glad to hear that. It's nice that you found a fit there. Do you mind if I just ask you about some clinical areas? Is that okay?
Oh, sure. Go ahead. Yeah, sure.
You mentioned about the opioid prescribing, and many foreign-trained doctors struggle with a couple of areas, especially when dealing with patients with, say, things like mild to moderate mental health problems, chronic pain, prescribing opioids. Besides the opioids that you mentioned, are any of those clinical areas giving you problems?
Well, it's the opioids, and I guess the approach to mental health,
Right.
issues is a bit different than I'm used to. Also, yeah,
Yeah.
probably those two things.
Okay. Well, it's really important that you have identified that prescribing opioids is an issue for you because we really don't want you to get in trouble with the college around that.
No.
Many people do. So, would you be interested in taking some courses in managing chronic pain patients?
Um, I suppose. I guess I'm not sure what kind of time commitment that would be. That is a big concern as I'm, working so much on, studying, making sure I'm current in a broader range of things than I've been
Right.
doing. So,
Right.
yeah.
Well, there are some good online courses that you could take, especially around the opioid prescribing. And there's a great online site called Pain BC that's very worthwhile in dealing with patients living with chronic pain.
Mm. Okay.
Okay.
Yeah.
Are there any other clinical areas besides the ones that we've mentioned that you've identified as being ones that you'd
Um,
like some improvement in or that you've had
no,
problems with?
not so much. Those are the ones just I think about. It's part of it's like learning the system and the resources and what other things are there. I mean, I was used to having support of some RNs that
Right.
were doing some telephonic care and stuff, and we don't have that where
Yeah.
I'm at, and so I'm finding there's some stuff there I need to figure out how that works.
Oh,
Yeah.
so your clinic doesn't have RNs yet?
No. Yeah.
Oh, I'm a bit surprised about that. There's a lot of things going on around primary care networks. So,
Well, they're
um,
starting to do that. I mean, I
yeah,
just heard some of that stuff, but we haven't.
okay.
Yeah,
Maybe
I
you're,
think they had somebody and then they left, and they got pulled, and I don't know. It was kind of a bit of a when I came.
yeah, it could be that your community's a bit behind or something in there. So it might be catching up. But you did mention something about, I caught about logistics and billing is often new and an issue with many new doctors. Are you having troubles with your billing?
Well, I mean, I'm trying to understand the billing process here, but it was such a it's I guess the nightmare where I was. I mean, I spent so much of my time working on billing in the U.S. and the different insurance companies and who covered what, and I am so relieved to not have to worry about that. But it is one more system I am having to learn. That's right.
Yeah. Well, I'm surprised you're not having more problems with that. But if you want, we can connect you with some online courses on billing. Would that interest you?
I suppose. Yeah. I mean, yeah. It's a lot. You're talking to me about doing. I'm already a little concerned about some of the time. Yeah.
Well, yeah, and I apologize. I don't want to be throwing things at you, and we can help you in many different areas. But
Mhm.
thinking about what we've talked about, what would be your priority for where we can help you?
Well, I guess the thing that, well, I guess because it would also help me with exams and stuff. I can think the thing that I do spend time thinking about outside of work is the opioids.
Right.
Yeah, I'd really like to make sure that I stay clear on that and what's really going to be the best practice for the community. I mean, I find they have there's a high expectation among the patients about prescribing, and I have a lot of patients that I don't know, frankly, I don't know why they're on them, and so
Yeah.
I'm struggling a little bit with that, and you know how people are not happy when you start talking about those drugs.
Yeah. Well, like I said to you before, we want to make sure that you don't get into trouble with the college. And, you may have been stuck with the prescribing habits of a doctor that had looked after the patients before you took over. So, we
Yeah,
can
I
certainly help.
inherited. Yeah,
Yeah.
okay. Mhm.
Well, to summarize, it seems like you could use help in dealing with a couple of clinical areas: chronic pain, perhaps prescribing opioids, billing, and you had mentioned about needing help with those licensing exams. Which one would you like to start with first?
Well, it's interesting that you asked that. It's I mean, I'm really focused on exams because if I
Yeah,
don't do well in the exams, then none of the other stuff matters, right?
right.
But so yeah. Hmm.
So I presume you're planning to write the exams next May? You're
Yeah,
hoping to
that is the
April and
plan.
May? Okay.
Yeah.
So when would you like to get started on getting some support for studying the exams?
With school starting up again here, I'd like to get my kids settled a little bit, and then I was thinking when they go back to school, I can tell them I'm going back to school, and then
Right.
maybe we could work something out that way, and so they understand when it's study time.
Okay, so you're starting about getting going in September.
Yeah. Yeah.
Okay. And I'm curious, about one of the things that we try to do when we're looking at setting a goal is trying to make it smart. In other words, specific, which is studying for exams for you, but also measurable. So if we were measuring what success would look like for you in being able to study for exams, how would we measure that? How would you measure success in there?
Well, success is going to be passing, right?
Yes, right.
Yeah, that's the ultimate goal.
Okay.
Yeah.
And what specifically would you like for help in being able to achieve that goal for the studying?
Well, I guess just knowing that there's somebody like checking on me, I guess. I mean, it kind of sounds funny, but the accountability of it, I suppose, is what I need. Because there's so many other things that start to pull,
Yeah.
on your time, right? With the
Yeah.
teenagers around, and it's been hard enough for them to be in a new community. So there's a bit of stuff happening around home with this settling in. So
And we do have some specific things. There is an online site that has all the exam questions from previous exams. So we could link you with that. You could go through them. And also, many people are interested in actually being part of a study group. And so we could link you with that. But certainly, if there's any specific areas that you feel the online questions help you identify those weak areas. So are those things that would you be interested in?
yeah, sure. Yeah, those sound like good things to explore.
And is there anyone else that you'd like to get you to help being able to achieve that goal?
Well, I mean, my partner. So, that would be really important. She would need to be alongside with me too. Because right now, she's not working. And so there's
Okay.
yeah, yeah.
And so just so I get it straight in my mind, could you repeat the goal with those specifics just so we're sure that we've got this covered?
Yeah. So, I mean, we've been talking about, devoting some time for exam study, and making some kind of a plan starting in September to, get organized around that.
And how confident are you if you were looking at a scale of 0 to 10 on being able to achieve the goal of passing the exam?
That's a really interesting question. I don't know that I really thought about it before. I mean, I have a lot of years of practice, but,
Right.
taking a test, haven't been doing that. So,
Yeah.
I suppose it's a 7 or an 8 though.
Okay.
I'm pretty comfortable with my clinical skills. It's just the whole exam.
Okay. Well, we can certainly help you with that and get you going. And we'll send you some information that you can look at. And the concierge that's on the call with us will follow up with you to get that, to find out from you what things specifically you'd like to start in on and get going with. So we'll pass that on to you, and we'll try to get that to you in the next week or two. And after that, when would you like us to follow up with you on this?
Well, let's see, maybe after Labor Day.
Okay.
Let's set up a time to meet after Labor Day.
Okay, so the concierge can get that going and set that up with you. Because it does sound like now you've got enough on your plate with this goal. So I'll pass it over to the personal learning plan concierge to give you some more details on further information that we can supply you with, and the specifics of how we'll follow up with you, and touch on some of those other areas that you identified that you want to work on. Did you have any other questions?
No, that's fine. This has been helpful.
Okay,
Yeah.
great.
Thanks.
Well, it's been really nice meeting you, and I'll pass you over to the concierge.
Okay, good meeting you too.
Okay, take care.
Bye.